Okay, we're continuing with the book here, Prevent and Reverse Atrial Fibrillation and CHF by me, Pete Rogers. We are on page 65, talking about congestive heart failure, chapter 5. And so basically, the title of the book is Prevent and Reverse. So the question is, can you reverse congestive heart failure? The answer is yes, of course. It's been known since a long time. Walter Kempner was reversing CHF back in the 1940s, 50s, and 60s. Okay, there's more recent papers. We'll talk about those in the next session, but I'll just get you started here. CHF means congestive heart failure. It's super common. I've had times when I got internal medicine doctor friends who tell me every single patient on their service has CHF. Let's see, CHF means the heart's not pumping blood well, ejection fraction's dropping. Normally your ejection fraction is going to be about 55% to 70% in that ballpark. And you'll see EFs going down, down, down into the 30s, the 20s, the teens. HF itself just means heart failure. When you see HF, PEF, that means heart failure with preserved ejection fracture. When you see it with REF, that means heart failure with reduced ejection fracture, okay? Like we said, of course, the low-fat vegan diet can reverse it. The more strict you are, the better chance you have. This was a great biography of Walter Kempner. It was written by Barbara Newborg. She's a doctor who worked with him. There's other docs who work with him, like Frank Nealon. Frank Nealon had some interview videos with Dr. McDougall on the Dr. McDougall YouTube channel. In this book, they show a whole bunch of chest x-rays where the heart shrank, came back down to a more normal size as the patient responded to dietary treatment for congestive heart failure. Here's the name, Dr. Newborg. Okay, he was reversing CHF with the diet was, a low-fat, low-sodium, 100% vegan diet consisting of white rice, fruits, fruit juices, and a multivitamin. This is a summary of the research publication of Dr. Kempner, Volume 2. It's available for free at the drmcdougall.com website. The Volume 1 is really not that good because it's mostly in German, but Volume 2 is in English, so you can read it pretty easily. So that's what he did. And Kempner said his goal was a lot of his patients were kidney failure patients, so he wanted to minimize their nitrogen intake, minimize their protein intake. There's only nitrogen in protein. There's no nitrogen in fats and in carbohydrates. So that was one of his goals. He wanted to minimize sodium because sodium is a vasoconstrictor. It not only causes high blood pressure, it also decreases blood flow to the kidney, which can worsen kidney failure. Okay? And by getting this stuff optimized, you'll improve blood flow within the heart, within the intramyocardial branches of the coronary arteries. And when you have good blood flow to the muscle, it's going to perform better. Okay. When the blood's a little bit thinner because you don't have the high-fat diet sticking the red cells together, causing low formation blood sludge, that means it's easier to pump blood to your brain. You get easier to oxygenate your brain so you don't have to pump at such a high blood pressure. That makes life easier for your heart. The left ventricle doesn't have to contract so forcefully, so it functions better, okay? So that's pretty much the scoop. Like I said, you can read that pretty easily, all at his site. He was also reversing with that same diet, hypertension, obesity, diabetes, coronary artery disease, atherosclerosis, diabetic retinopathy, hypertensive retinopathy, and congestive heart failure. They showed reversal of EKG findings, reversal of chest x-ray findings. It was rather impressive. Okay, so that's it for today. Next time we'll go through some of the more recent papers showing the reversal of CHF with dietary treatment.